Our attention is on an epidemic. Carfentanil, an elephant tranquilizer dealers are cutting with heroin and cocaine, is becoming a deadly problem across America. But the drug remains largely underdetected, undertested, and underreported, and not one government agency is tracking its presence. Angela Hill from our Scripps Washington Bureau reports in this final episode of our series, Getting a Fix.
She was crumpled up on the floor, and I just thought, well, Chrissy, and my mind was just racing.
Lisa and Jeff Lutz made a grim discovery in their Northern Virginia home.
She was cold to the touch when I touched her.
Their 21-year-old daughter, Chrissy, had recently moved back home to get help conquering her heroin addiction. But that fateful day in August last year, she lost her battle with drugs.
Our world fell apart.
Yeah.
The toxicology report originally listed heroin as the cause, but 8 months later, the Virginia medical examiner retested Christie's samples and made a startling discovery. They found carfentanil, a drug 10,000 times more potent than morphine that's strong enough to tranquilize an elephant.
We've heard of fentanyl, but certainly carfentanil was we never heard of that.
And they're not alone. Despite hundreds of deaths from overdose across the country being linked to carfentanil, many medical examiners and county coroners still don't test for the drug.
We have to be judicious about what testing we order in what cases.
Dr. Russell Vega is a medical examiner for Manatee, Sarasota, and DeSoto counties in Florida. His office does test for carfentanil, but says many in the medical community
don't have the resources to do the testing in certain cases, or cases fly under the radar because there's no reason to suspect to do testing in that particular case.
In fact, in a Scripps News survey, medical examiners and coroners in 189 out of 389 counties said they have never tested for carfentanil. That's nearly half of those that responded. Dr. Vega's office began testing for carfentanil only after a rash of unusual drug overdoses hit his counties in the summer of 2016.
That test to identify the drug in biological samples didn't exist at that time.
Months later, when a test did become available, his team went back and retested samples from previous overdose deaths, finding 113 related to carfentanil in 2016.
From June until December, we had more deaths from carfentanil in the district than we'd ever had from any one drug, ever.
When we see a spike in overdoses, the first thing I think is there's some carfentanil out there.
Melvin Patterson is with the Drug Enforcement Administration. He says the agency is working with communities to get a better handle on the full scope and impact of carfentanil across the country.
The overdoses that we do see, a lot of times they're not sure, they're not positive if they're not testing for carfentanil or fentanyl.
Whatever numbers we have for carfentanil locally or statewide or nationally, they're underestimates because there's no question that there are cases that we're missing.
And that's largely due to the fact that testing for carfentanil can be expensive, costing upwards of $1,000 per case. But help may be on the way. The President's Commission on Drug Addiction is expected to release a report in early November with recommendations to combat the opioid crisis. I'm Angela Hill reporting for Scripps News in Washington.